Hello, dear students and esteemed learners. Welcome to my course on Sociology of Health. This is lecture number 34, and the topic for today's lecture is healthcare structure and government healthcare system in India. This week, we are talking about the healthcare system in India, and till now, we have discussed important things like how this healthcare system, which is often stated as health system, has developed, and what was the role of the various expert committees, and then what was the role of the vaccination programs and immunization program in ensuring a good health system in India, and then how the various important disease control programs came into existence and what kind of achievements they actually made. How did they become successful in controlling some of the very important communicable disease and of course became successful in eradicating some of those. So those are actually the integral part of the healthcare system of India. And in today's lecture, we'll talk about the structure of the healthcare system and then the role of the government healthcare institutions and the overall healthcare system. This particular topic is not very articulated in the way that there are good number of institutions, a complex of institutions, processes, and individual events, and together those are making the healthcare system. So still we have tried to make some kind of structure so that you can get a good understanding about how the healthcare system in India is actually operating, and how this is delivering the services what we are getting as people of this country. So the topics that I have included here is this health system in India, a brief background, then structure of healthcare system in post-independence India, then healthcare system. I have added two figures here so that you get a pictorial understanding, representation, and then the government healthcare system. And then at a later stage, I've talked about the primary health care, that is very important, and how the primary health centers in India are trying to uh, meet with the standards set by World Health Organization in terms of primary health care, and then how these are getting converted into health and wellness centers after the National Health Policy 2017 recommendations. So these are the things that we are going to discuss. Okay, let us go to the first slide. So health system in India, if we try to understand the background, then we are already aware of so many things. Basically, we have understood that the healthcare practices are very diverse and complex, and these basically develop differently in different societies, and that is why we also say that the health practices or healthcare practices are cultural. So because of that, in India we are having and we were having different types of healthcare practices and beliefs related to that. That is creating a kind of diversity. Then in a democratic country, basically people expect decentralization and then some kind of participatory role in the various institutions also. So is the healthcare system reflecting those democratic beliefs and values which people already have? So we will try to understand these things, but as of now, we can say that because of the imperialism and the impact of imperial forces in the era, or you can say in the pre independence era, there were things which were developing in a specific way, and after independence, things took a different direction, a more democratic direction, and then the healthcare institutions developed in a very comprehensive way. So that is something that we need to take into consideration. Uh, so we can say that the health system in India, which is the existing one, is diverse, pluralist, and multi-layered. Multi-layered in the sense that they have incorporated and over a period of time integrated the different systems of medicine, some of which were also identified as the preventive system of medicine, or maybe as the curative system of medicine. And then often we talk about the biomedical system of medicine, then alternative system of medicine, or the traditional or even the indigenous system of medicine, which are collectively represented by the term Ayush. And then simultaneously everything got somehow intersected by the public health measures also. So all those things were happening in last 200 years. uh, we have discussed in one of the lectures that the smallpox lymph vaccine arrived India in early 19th century. And then by early 20th century, we had at least four vaccines like smallpox, cholera, plague, and typhoid. So that way, the vaccination program got impetus in India. It has started to show some kind of achievement, and then we had already started the malaria control program before independence, and then we had the Bore Committee in the 1940s, which has already recommended a multi-tier primary health center approach. So these were the things which were happening in India in the pre-independence era. Then there are two very important things which are visible even today. One is the medical needs of the army, military, or you can say the defense forces. Because of the specific requirements of the defense forces, they were having some specific arrangement, or you can say medical college and institution and dispensary and whatever facilities were required, so that they can get the emergency services during the time of need, right? So the defense forces had a separate facility, or you can say arrangement of the medical care centers. And similar was the case with the railway. Because of the huge number of employees in the railways, and then the kind of challenges that they have to face when they are basically expanding the facilities. So the railways also had a specific kind of health care facility or the medical care facilities. And simultaneously, we will see that the government employees were also having some kind of specific healthcare facilities or services. So all these things, basically, why I'm talking about all these things, because there are so many things which are interrelated, sometimes overlapping each other. So when we try to understand the the hierarchy, or you can say the rank, or you can say the arrangement, but arrangement would be the better word, the arrangement of these institutions, then that is often appearing confusing. But because we wanted to understand the structure of healthcare uh, centers in India, healthcare facilities in India, so we have tried to rise and to develop some kind of structure or pattern in that. So primarily, the health sector in India is characterized by three sectors that we all know: the government sector and the private sector. The private sector is basically the fee-levying private sector, for-profit organization, and then a third component is the not-for-profit sector, that is generally known as the NGOs or the hospitals or dispensaries run by some of the trusts or civil society organizations. Then the Constitution of India basically has divided the role of the center and the state for the various services, and the health services, although these are coming in the concurrent list, but the state government are supposed to provide the services which are generally related to the day-to-day affairs, and the central government is basically responsible for giving direction, then having the kind of regulations which are applicable at all India level, and several other supervisory roles. So this is a kind of division of work which is applicable in all other sectors, and so in the health sector also. Now, what is important here is this, that the urban local self-government organizations, which are generally known as the municipal corporations, these are very important in terms of providing the public health services, something that we have studied earlier also. So with this understanding, we come to this specific diagram. I hope everything that I have stated till now is visible in this diagram. You can say that the healthcare system in India is basically related to three things: the private sector, the government sector, and the non-government organizations. And the private sector is basically in India, the private sector is having almost 70% contribution in the overall health system. The government system is having something around 30%. The percent or the exact number will vary, but I'm approximately, you can say that 65 to 70% kind of thing. Anyway, the private sector is basically having the medical colleges, then the research institutes, then the hospitals, clinics, and the individual practitioners. We all have some kind of fair understanding about the presence of the private sector. And the NGOs are running some of the hospitals or the clinics. So sometimes we also get to know about these things. So the rest of the institutions basically are coming under the government sector. And within the government, we have the central government and the state government and the local self-government, as we discussed in the just some time before. Now, we are not talking about the state government here, because state government is also generally replicating the model that is built up by the central government. But of course, it is not including those institutions which are directly coming under the control of the central government, and it cannot make that kind of regulation which are basically made by the central government. So keeping aside those things, the execution part is like that. However, at the level of the central government, there is Ministry of Health and Family Welfare and the Ministry of Ayush, something that we discussed earlier also. And then there are various other ministries, basically. For example, the ministries related to water or food or public distribution, and then something which is related to the environment and road safety, etc. So all these ministries are playing an important role in ensuring a viable public health, right? So these are important here. And then we have the Ministry of Defense and Ministry of Railway, as we stated just before, that they are having their own system of medical care. So within the Ministry of Defense, you can find that there are dispensaries, then hospitals, then a specialty hospital, and even the army medical colleges and hospital. So those are primarily getting governed by Ministry of Defense and often exist as stand-alone kind of institution, but we are just trying to understand the structure, so we will not say anything specific here. And the Ministry of Railway is also having its own hospitals and dispensaries, right? So we talked about all the possible agencies except the Ministry of Health and Family Welfare and Ayush. So we will go to figure number 2 to understand their engagement with other institutions. So this is the larger picture which is prevailing. We discussed about all those things which come in the periphery. Of course, the private sector is not coming in the periphery, that is the dominant one, but because we are not talking about that, so in this context I have stated that as a periphery. So this is the a larger picture, and you can see that at the bottom basically we are having the sub center and then the primary health center. So the health structure in India, or the health system in India, is primarily supported by the primary health centers and sub centers at the bottom level. So people generally directly come in contact with these centers, and they get the health facilities and the health care at this level. And you can see the ASHA and AWC. So basically, ASA means the accredited social health activists. They are appointed at the level of the Gram Panchayat, and then we have the Anganwadi centers, and then we also have the ANM workers. They are all operating at the grassroots level, the Gram Panchayat or the sub center, or at the level of the primary health center. So this is at the bottom or the grassroots. We should not say the bottom, but at the grassroots, because people are directly getting benefited by these. Then we have the municipal hospitals and dispensaries, which are basically located in the urban areas. So the primary health centers are there in the rural area as well as in urban area also, but the municipal hospitals are primarily situated in the urban areas. And then we have the community health centers, and the community health centers are also identified as the first referral unit, because they are having some kind of facilities. Basically, the community health center, we will see in some of the next slides that what kind of facility basically they are having. Then above this, we are having the district hospitals. So there is a kind of rank, or you can say the hierarchy, that we have the district hospital, and below that we have the community health centers, and below that we have the primary health centers, and then sub centers, and simultaneously we also have the municipal hospitals and the referral or the dispensaries, and these are operating at the grassroots level. Now above these, we have a good number of medical colleges which are also working as hospitals, and sometimes some of these are also working as some of the dispensaries also, maybe depending upon the specific situation. So on the one side we have the biomedical medical colleges, basically, which are generally known as the allopathic medical colleges, and on the other side we have the Ayush medical colleges. That means the medical colleges which were supposed to provide education and degrees in Ayurveda and Unani and Siddha and the other Ayush medicine systems. Then very interestingly, we have these two other institutions, that is the CGHS and ESIS. So this CGHS is basically the central government health scheme. Because the central government is having a huge number of employees, so they also have their own specific institution, so that they can provide the health care needs of the employees, right? And the central government employees also get transferred from one place to another place. So there is one specific arrangement for the central government employees in the form of CHGS dispensaries and hospital. And simultaneously, we also see that there is ESIS, and that is basically Employee State Insurance Scheme, right? So there are state insurance schemes also for the employees, and they are also running their own medical colleges and hospitals. So because of these CGHS and ESIS hospitals, often we get some kind of confusion that how where do they exist in terms of the administration. But yes, these are all somehow getting governed by the rules and regulations made by the Ministry of Health and Family Welfare. And then above all these things, basically we have the various medical colleges, whether those are basically operating at the level of the state government or at the level of the central government. And then we have at the top of all these things basically the All India Institutes, basically the AIIMS and several other research institutions. which may not have direct hospitals, but they are conducting the health related research. So this is the larger healthcare system, and it may not be visible that way, exactly that way, in some of the states, because some of these institutions may not be present in those states. But if we want to understand something at the all India level, then we can find these institutions. Of course, there would be some other institutions or some other structures that I have not included, because I'm already saying that this is complex, and there are a good number of things which are basically existing in parallel to each other. And then there are certain things which are very specific, and then above all, health is a state matter at a larger level, so the state government may have several other things which will vary from state to state. So with this kind of understanding, I think that we can move to the next slide, and here we will try to understand very specifically the government healthcare system, and how that is divided at the level of the administration, because the kind of ranks and division that we are talking about, this is something which is related with the administration, and often we identify those health centers by their administrative names only, right? So this is the popular perspective to understand these things. Of course, there can be the technical terms like the preventive care or the curative care or the biomedical or the traditional, but we have already understood those things. As of now, we are trying to understand the way health system is operating in India. So we have the national and the state level functionaries, and at the national level we have the union government and we have the ministries. So we just talked about those things. And then at the state level we also have the ministries, but at the central level we have the Ministry of Ayush, but at the state level you may not have a ministry which is independently talking about Ayush or some of the systems of medicine, but those may get reflected in the ministry related to health itself, and the nomenclature may vary from state to state, right? Then the organization at the state level, this is basically the Department of Health and Family Welfare. Generally in every state, the health department is known by this name, and that is headed by a minister, and then of course by some secretariat, and then other officers, right? So one thing that is important here is this, that these are headed by an IAS. So that is the administrative structure. Then we have the regional and district level organizations in the states of Bihar, Madhya Pradesh, Uttar Pradesh, Andhra Pradesh, Karnataka, and few others. There are zonal or regional or divisional setups, and these have been created as some kind of agencies which are connecting the state level functionaries with the district level functionaries, right? Because ultimately people get benefit of the health system at the district level and the grassroots level, right? So at the top level we have the administrative system or the regulating system, and at the bottom we have the delivery system basically. So we are talking about the delivery system, right? So at the district level we are again having two things. One is the delivery part and another is the administrative part, because we are having good number of primary health centers and the community health center, the sub center. So there is an administrative structure required to monitor, regulate and administer that. So taking care of those things, for taking care of these things, basically there are district level structures also. But now we come to the healthcare delivery systems, basically where people get the kind of services that they are in need of, and we can identify three core structures, and these are also identified as the backbone of the healthcare system in India. So we have the community level centers, like the community health center and the primary health center and the sub center. So we will begin with the sub center. Sub center is the most uh, peripheral health institutional facility which is uh, available at the grassroots level for a population of around 5,000 people, but it may vary depending upon the location of the village, and then the kind of geographical context that it is belonging to. For example, in the hilly and desert areas, these required population for having a sub center could be 3,000. It may vary, right? So this sub center is not having any qualified medical doctor, but they have the trained one male and one female multi-purpose health worker. Often we have the ANMs operating at that level, and their purpose is basically to guide the women during pregnancy and to guide them for some kind of health services which could be required, which is generally known as the antenatal or the postnatal kind of services. So they are there to help people and guide people and then provide some kind of first aid services if required, because at the sub center level they are not having any qualified doctor. And then we have above that the primary health center, and that is generally meant for a 30,000 population, and each primary health center has one medical officer, then two health assistant, one male and one female, and the health workers and supporting staff, right? So this is the center where people get the health facilities. If anybody is not is not feeling comfortable or is having any kind of illness or sickness, then he can directly go to the primary health center and can get checked up by the doctor available there and can get services there, the medicine there, whatever. Or if the doctor is finding that the person is in some kind of problem, and for this he or she needs some kind of higher level of intervention or treatment, then that person is basically, the doctor is referring the person, after giving some kind of medicine, referring that person to go to the higher level center, and that is the community health center. So community health center, which is operating at the level of the blocks, is primarily meant for 80,000 to 1,20,000 population, and this is a hospital, and it provides all basic specialty services like the pediatrics, the surgery, obstetrics, and gynecology kind of thing. So this is a full-fledged hospital, and this is often identified as a referral center also, because people who are in need of the specific health services from surrounding area can come to the CHC. So this is the core structure, and then basically we have the secondary level and tertiary level referral centers also. So when CHC is operating as the first level of this referral level, and then the district hospitals could be the at the second level of referral level, and the all India institutes or medical colleges are actually the tertiary level centers where people go for the treatment in case they need the specialty treatment. So talking about the healthcare system, one thing is very important, that is to understand the primary health care. And primary health care is very important because Alma Ata Declaration has already stated that this is important for achieving the goal of health for all. So globally, basically the nation states have tried to strengthen the primary health care, and in India basically we have the concept of primary health centers, and the first primary health center was established in Nazafgarh, Delhi, way back in 1952 under the Community Development Program. And then as of today, we are having good number of primary health centers, and then sub-centers and some of the figures I have included in this slide. And then one important thing here is this, that under the National Health Policy 2017, the primary health centers are recommended to be upgraded as health and wellness centers, and they will have basically more comprehensive primary health care. So there are few numbers also, that certain number of primary health centers have been upgraded as health and wellness centers, but this needs a full-fledged talk, and we'll talk about this when we will discuss the national health policies and other related things. So before I close, I would like to acknowledge that most of the data and information have been taken from either the government websites or World Health Organization website. And then one specific publication I would like to mention here, that is from Chandrakant Laharia, and I have mentioned the references. So this is the acknowledgement part also. And with this, I close this lecture. But before you close it, just have a look on the think about this and activity question. So we will meet in the next lecture. Until then, take care.